What if I told you there's a silent threat lurking inside millions of men, often undetected until it's too late? A disease that starts quietly, without warning, only to strike when the odds of survival are drastically lower. The shocking truth? It could be happening right now, and you might not even know it. Prostate cancer is a slow-moving predator. Unlike other diseases that announce their arrival with sharp pain or sudden symptoms, this one often remains hidden, progressing silently over the years. By the time it makes itself known, the battle becomes much harder to win. But here's the good news. You have the power to fight back. If caught early, prostate cancer has a survival rate of over 98%, but only if you recognize the warning signs in time. 1 in 8 men will face this diagnosis in their lifetime. This year alone, over 288,000 new cases are expected in the U.S., and tragically, nearly 35,000 men will lose their fight against it. These aren't just numbers. They represent real fathers, brothers, husbands, and friends. But what if you could prevent this? What if simply paying attention to your body could save your life? In this video, we'll reveal 8 crucial warning signs of prostate cancer that you absolutely cannot ignore. Some may seem harmless, even ordinary, but together, they could be the red flags your body is waving. Stay with me until the end, because one of these signs is often overlooked, yet it can be a major indicator of something serious brewing beneath the surface. Before we dive into the warning signs, let's take a step back. To truly understand why these symptoms matter, we need to first understand what the prostate is and how cancer develops within it. The prostate is a small but mighty organ, about the size of a walnut, sitting just beneath the bladder and wrapped around the urethra, the tube that carries urine out of the body. Think of it as the gatekeeper of the male reproductive system, producing the fluid that nourishes and protects sperm. But here's where the danger lies. This small gland can become the breeding ground for one of the most common and deadly cancers in men. Not all prostate cancers play by the same rules. Some move so slowly that they remain hidden for years, allowing men to live their entire lives without ever noticing a thing. These cases create a false sense of security, where someone may feel completely fine, but is unknowingly carrying a silent threat. But then, there's the aggressive kind, the one that doesn't wait. This version grows fast, spreads beyond the prostate, and can quickly invade nearby organs, bones, and even the lymphatic system. By the time symptoms become noticeable, the disease may have already advanced to a dangerous stage. This is exactly why early detection is so critical. Catch it early, and you have a 98% survival rate. Miss the warning signs, and that number drops drastically. So, what are these early red flags? What does your body do when it's trying to warn you? Let's break it down, starting with the first silent sign that too many men dismiss. 8 silent signs of prostate cancer you can't afford to ignore before it's too late. Your body has a way of speaking to you, sending subtle warnings before a problem escalates. The challenge? Most men ignore these signs, dismissing them as minor inconveniences or part of aging. But these silent signals could be the key to detecting prostate cancer early, before it becomes life-threatening. Here are the 8 warning signs you cannot afford to ignore. Some may surprise you, others may seem unrelated, but together they form a pattern that could save your life. 1. Frequent urination, especially at night. Have you noticed yourself waking up multiple times at night just to use the bathroom? You might think it's just getting older, but what if it's something more? The prostate sits just below the bladder and surrounds the urethra. If it becomes enlarged due to cancer or other conditions, it can put pressure on the urethra, making it harder for urine to flow freely. This leads to more frequent urges to urinate, weak or interrupted urine flow, the feeling that your bladder is never fully empty. If this is happening persistently, don't brush it off. Yes, aging and benign conditions like BPH, benign prostatic hyperplasia, can cause similar symptoms, but only a doctor can determine the real cause. Getting checked could mean the difference between early treatment and a late-stage diagnosis. 2. Painful ejaculation, a warning sign you shouldn't ignore. Pain during ejaculation might seem like just an occasional discomfort, but what if it's actually your prostate trying to send you a warning? The prostate is responsible for producing seminal fluid, and when it becomes inflamed or affected by cancer, it can disrupt this process, leading to burning or sharp pain during ejaculation, discomfort in the lower abdomen or perineum, a feeling of tightness in the pelvic region. If this pain is recurring and paired with other urinary issues or pelvic discomfort, it could be a red flag. Prostate inflammation and tumors can cause these symptoms, and only medical testing can rule out something serious. Number 3. Blood in urine or semen, a sign that must be taken seriously. Seeing blood where it shouldn't be is always alarming, but did you know that many men ignore this sign until it's too late? When cancer develops in the prostate, it can disrupt nearby blood vessels, leading to bleeding in urine, hematuria, or semen, hematospermia. Sometimes the blood is visible, other times only detectable through medical testing. If you notice even the faintest streak of blood, don't wait. While infections and minor inflammations can cause similar symptoms, prostate cancer is a possibility that must be ruled out. 4. Pain while sitting, more than just a minor annoyance. Do you ever feel a dull, persistent discomfort when sitting, almost as if there's pressure in your lower pelvis? As prostate cancer progresses, it can cause swelling or inflammation, creating pressure against surrounding nerves and tissues. This can lead to deep aching pain in the perineum, area between scrotum and rectum, discomfort that worsens after long periods of sitting, radiating pain toward the hips or lower back. If this discomfort is new and persistent, consult a doctor. While conditions like prostatitis, inflammation, or nerve compression can also cause similar symptoms, prostate cancer must be ruled out. And those aren't the only signs. In the next part, we'll cover more symptoms, including one that often signals that prostate cancer has already started spreading. Stay until the end, because recognizing these warning signs early could literally be the difference between life and death. Number 5. Persistent pain in the back, hips, or chest, a silent warning of cancer spread. Back pain, hip pain, chest pain. These are symptoms most people attribute to aging, poor posture, or even a long day at work. But what if they were something more? Prostate cancer doesn't always stay in one place. In more aggressive cases, it spreads beyond the prostate, with bones being one of its primary targets. Once cancer reaches the bones, it can cause persistent, deep-seated pain that doesn't improve with rest. A dull ache or sharp pain in the lower back, hips, or ribs. Pain that gradually worsens over weeks or months. Unlike typical muscle or joint pain, this pain doesn't go away with rest or simple painkillers. If you notice a lingering pain in these areas, especially one that seems to worsen rather than improve, it's time to take action. Don't dismiss it. If your pain has been ongoing for weeks, is gradually worsening, or comes with other symptoms on this list, consult a doctor immediately. Early intervention is key. 6. Swelling in the legs or feet. The unexpected sign linked to prostate cancer. Most people associate swelling in the legs or feet with heart issues or poor circulation. But did you know that in some cases, it can be a warning sign of prostate cancer? Your body has a network of lymph nodes that help drain excess fluids and toxins. But when prostate cancer spreads to the lymph nodes, it can block this natural drainage system, leading to unexplained swelling in the legs, ankles, or feet, a feeling of tightness or heaviness in the lower limbs, skin that appears shiny or stretched over the swollen area. Unlike swelling from sitting too long or an injury, this swelling doesn't go away on its own. It may start in one leg and progressively worsen. If you experience persistent swelling that doesn't subside, particularly alongside other symptoms like urinary issues or pain, get checked. It could be lymphatic obstruction caused by advanced prostate cancer. 7. Unintentional weight loss. When your body starts sending an urgent signal. Have you been losing weight without even trying? While sudden weight loss might sound like a good thing, it can also be one of the first red flags of cancer. Cancer cells demand a huge amount of energy as they multiply. This can disrupt your metabolism and cause rapid weight loss without changes in diet or exercise. Loss of muscle mass and increasing weakness. Persistent fatigue despite adequate rest. Losing a few pounds here and there is normal. But if you've lost more than 10 pounds in a short period, without trying, it's time to ask why. Your body might be fighting something serious beneath the surface. If weight loss is combined with fatigue, pain, or changes in urination, don't wait. A medical checkup can help rule out cancer or detect it early enough for effective treatment. 8. Numbness or weakness in the limbs. A sign cancer may have reached the spine. Imagine waking up one day and feeling a strange weakness in your legs, or experiencing tingling in your arms that won't go away. These aren't just random sensations, they could be a sign of something serious. In advanced cases, prostate cancer can spread to the spine, pressing against the spinal cord. This can lead to numbness, tingling, or weakness in the legs or arms, difficulty walking or balancing, loss of bladder or bowel control in extreme cases. Once spinal cord compression begins, nerve damage can become permanent if left untreated. Ignoring this symptom could lead to paralysis. If you experience unexplained numbness, tingling, or difficulty moving, seek emergency medical attention. Spinal cord involvement requires immediate treatment to prevent permanent damage. Risk factors for prostate cancer. Prostate cancer doesn't strike at random. While any man can develop it, some face a much higher risk than others. The question is, are you one of them? By understanding the key risk factors, you can take proactive steps to protect your health. Let's break them down one by one. Age, the greatest predictor of risk. The older you get, the higher your risk. But at what point should you start paying serious attention? The data speaks loudly. Risk increases sharply after age 50. Most cases, about 60%, are diagnosed in men over 65. While rare in younger men, early onset cases do happen, especially if other risk factors are present. If you're over 50, regular prostate screenings, PSA tests should be part of your routine health care. If you have other risk factors, you may need to start even earlier. Family history. The genetic link you can't ignore. Does prostate cancer run in your family? If so, your risk isn't just slightly higher. It could be dramatically increased. Here's what you need to know. Having a father or brother with prostate cancer doubles your risk. If multiple family members have had it, your chances increase even more. Inherited gene mutations, such as BRCA1 and BRCA2, may also play a role. These same mutations are linked to breast cancer. If you have a family history of prostate or even breast cancer, talk to your doctor about genetic testing and earlier screenings. Knowing your risk gives you control over your health. Race and ethnicity. Why some men face a higher risk. Not all men face the same level of risk. Research shows that race and ethnicity play a significant role in prostate cancer statistics. African American men are 70% more likely to develop prostate cancer than white men. They are more likely to be diagnosed with aggressive, fast-growing forms of the disease. Hispanic and Asian men have lower rates, but should still be aware of other risk factors. If you are at higher genetic risk, don't wait for symptoms. Schedule regular checkups and advocate for early testing. Diet and lifestyle. The choices that may influence your risk. What you eat and how you live could be tipping the scale, either toward good health or toward increased cancer risk. Key dietary and lifestyle risk factors. Diets high in red meat and processed foods. Studies suggest that excessive consumption may contribute to prostate cancer. Obesity. Being significantly overweight has been linked to more aggressive and recurrent forms of the disease. Lack of exercise. A sedentary lifestyle weakens the immune system and increases overall cancer risk. What you can do. Add more fruits, vegetables, and whole grains to your diet. Incorporate at least 30 minutes of moderate exercise into your daily routine. Maintain a healthy weight to reduce inflammation and hormone imbalances linked to cancer growth. While genetics play a role, lifestyle is one factor you have the power to change. Small adjustments today can significantly reduce your long-term risk. Hormonal factors. The silent influence of testosterone. Testosterone is essential for men's health, but did you know it could also fuel prostate cancer growth? How it works. Prostate cancer cells thrive on androgens, male hormones, including testosterone. Higher levels of certain hormones may contribute to faster cancer growth. Some treatments for advanced prostate cancer focus on blocking or reducing testosterone production to slow tumor progression. If you're on testosterone replacement therapy, TRT, or have concerns about hormonal imbalances, speak with your doctor about how it might impact your prostate health. Final takeaway: why risk awareness is key. Understanding your risk isn't about fear. It's about power. The more you know, the better equipped you are to take control of your health. If you are over 50, have a family history, or fall into a high-risk category, don't wait. Talk to your doctor about early screenings and lifestyle adjustments that can make a difference. Call to action, empowering viewers to take the next step. If you've made it this far, you already know how critical early detection is. Prostate cancer is silent, but you don't have to be. The most powerful thing you can do right now is take action. Not just for yourself, but for the people who care about you. So what's your next move? Here's how you can take action today. Listen to your body. If any of these warning signs sound familiar, don't wait. Don't second-guess yourself. Your health is too important. Share this video. Think about the men in your life, your father, your brother, your husband, your friend. Would they recognize these warning signs if they saw them? Stay informed. Click that subscribe button and turn on notifications so you never miss an important health update. At the end of the day, your health isn't just about you. It's about the people who love you and depend on you. Take care of yourself. Take action. And let's spread awareness together.